Okay, I'm recording my surroundings, my drug cards, and all of my equipment, my med cart, and then here's Anna. See everything. I'm gonna write some things down before I start. Hi, my name is Danielle. I'm going to be your student nurse. First thing I'm going to do is perform hand hygiene and provide privacy. So today, looking at provider's orders, I will be administering your medication. Is that okay?
Yep.
Are you comfortable?
Yep.
Can I get your first and last name?
Joseph Smith,
And your date of birth?
10/05/1954.
And do you have any allergies?
Sulfon betadine.
All right, checking that. Looks good. So first, what I'm going to do is get your vitals before I administer your medication. And I'm going to, while your pulse oximeter's on, I'm going to get your respirations. I got 18 for your respirations, and your pulse ox is 98. I started off with my equipment already being sanitized, and I will sanitize again once I'm done. I am now going to get your apical pulse. My diaphragm side.
Oh, you have 1 gram of protein.
I got 78 beats per minute, which is within normal range. Now I'm going to get your blood pressure, making sure that this blood pressure cup is the right size and the artery marker is in the right place. The first thing what I'm going to do is I'm going to place your hand right there, and I'm going to feel for a pulse, and then get a baseline. Okay. About 110 is where I stopped feeling it. I'm gonna let her sit for a minute before I redo it. I'm now going to get her temperature orally in degrees Fahrenheit. Okay, 98.3, which is within normal range. I'm now going to listen to her blood pressure. And I got 112 over 72, which is within normal range. I'm going to sanitize my equipment since I will no longer be using it. Sanitize my blood pressure cuff, my stethoscope, and my pulse oximeter. I'm now going to gather her medications. Right now, I am checking the provider's order with the MAR. I have digoxin for 0.125 milligrams by mouth daily. It is active and for congestive heart failure. For Lasix or furosemide, I have 40 milligrams by mouth twice a day. For congestive heart failure, it is active and it has not been given yet. I have Coumadin, which is warfarin, for 5 milligrams by mouth daily for atrial fibrillation. That's not been given yet and it is still active. And then for PRN medication, I have acetaminophen 300 milligrams, and codeine 30 milligrams, which is Tylenol 3 by mouth every 4 hours as needed for a pain rating of 1 to 4. I'm going to ask my patient if he has any pain.
Yes, on my foot.
And where's on a scale of 1 to 10, how bad is it?
A 4.
And what type of pain is it?
It's sore.
Just sore? Okay. So since his pain rating is just a 4, I'm going to give him Tylenol 3 instead of oxycodone. It has not been given within the last 4 hours, so I'm able to give it. Now I'm going to gather his medication, starting with digoxin, 0.125 milligrams by mouth daily for congestive heart failure and atrial fibrillation. I have a 0.25 milligram tablet. I will cut that in half so that it is 0.125 milligrams. The package is okay. The integrity of the package is okay, and the expiration date is 06 of 2036, so that is okay. And then for furosemide or Lasix, I have 40 milligrams by mouth daily. And then I'm going to make sure that I have 2 20 milligram tablets, making sure that the integrity of the package is okay. And the expiration date is 06 of 2036, making sure that it is for Joseph Smith. It is. And then next I have Coumadin. I have a 5 milligram Coumadin, and this is 5 milligrams. The integrity of the package is good, and the expiration date is 10 of 2018. Since it is expired, I would dispose of it as of my agency's policies and notify the pharmacy to get more Coumadin so that I am able to give it. But for the sake of this video, I will be giving it just because I need it. Next, I'm going to get Tylenol 3. Which is 300 milligrams of acetaminophen and 30 milligrams of codeine. The integrity of the package is okay, and the expiration date is 7 of 2015. And just like with the Coumadin, I would dispose of it as of my agency's policies and notify the pharmacy. But for right now, I'm going to be using it for the sake of this video. So this is for Joe Smith, and I have the right dosage, and it has not been given yet, so I'm going to give it to him for his pain. For my second check, I have digoxin. For Joe Smith, I have digoxin, 0.125 milligrams by mouth daily. This is a 0.25 milligram tablet, and so I will be cutting it in half. And then I have Lasix. Oh, it's the right dose as it's by mouth, and the right time as it has not been given yet today, so I will be giving it. And then for Lasix, I have 220 milligram tablets. For Joe Smith, the route is by mouth, and the time it has not been given yet, so I'm able to give it now. And then for Tylenol 3, I have for Joseph Smith, I have 300 milligrams of acetaminophen and 30 milligrams of codeine. It is by mouth. It is the right time as it has not been given within the last 4 hours for his pain. I'm going to scan my medications, and now I will be taking them into his room along with my gloves when I cut the medication. Hi Joe, my name is Danielle. I'm going to be your student nurse. Pick this up. I'm going to sanitize my hands. I have some medication for you today for congestive heart failure, atrial fibrillation, and your pain. Is that okay?
Yep.
All right. So I'm going to put on my gloves. Your lab values are all within normal range. From today, you're at 1036. Your sodium was at 140, which is in normal range. Your potassium was 4, which is within normal range, and your INR is 2, which is still in normal range. And then on the 14th, you had your digoxin levels measured, and that was 1.5, which is not toxic, so you were able to get that medication. Now, for Lasix, you are taking this for congestive heart failure, and some side effects would be nausea, vomiting, diarrhea, rash, and I will monitor you for renal failure or an allergic reaction. All your vitals were within normal range, so I'm able to give it to you. I have 2 20 milligram tablets for your 40 milligram dose. And this inhibits the reabsorption of electrolytes so that you are able to get everything that you need. And then for Coumadin, I have you are taking this for atrial fibrillation, and the action as it interferes with blood clotting to reduce the risk of blood clots, and some side effects are nausea, rash, fever, and your lab values were within normal range, so I'm able to give it to you. If I'm able to open the package, there we go. And this is a 5 milligram tablet for your dosage. And then for your pain, I have codeine, which decreases pain impulse to decrease your pain. Some side effects are nausea, vomiting, dehydration, and urine retention, which is why I'll be monitoring your renal failure. And that is 300 or It's 300 milligrams of acetaminophen and 30 milligrams of codeine. And for your digoxin, which you're taking for congestive heart failure, I'm going to cut this 0.25 milligram tablet in half so that it is the correct dosage of 0.125, and dispose of this properly. And some effects are headache, nausea, vomiting, diarrhea, and your toxicity level was within normal range, so you're able to have it. And this makes the calcium more available for contractile proteins, which increases cardiac output and decreases heart rate and blood pressure. Here are your medications, and here is your water. Thank you. Do you have any questions about any of your medications?
No.
Is there anything else I can do for you while I'm here? I have time.
No.
I'm going to monitor renal and liver function and look for signs and symptoms of an allergic reaction. I will stay in the room until the patient has taken all their medication. A sublingual medication takes effect in 15 minutes, and oral medication takes effect in 30 minutes. If there was an adverse reaction, I would assess vitals, contact the provider, contact the pharmacist, and document as needed and stop all further medication. I am assessing the room for falls. Nothing is in the room to fall. Bed is lowered, bed is locked. Are you comfortable?
Yeah.
I will make sure the patient has a call light and bedside table within reach. I will document my findings and what medications were taken. I did my checks. Okay. All right. Thank you.